Hello. Today we are going to talk about tremors and how anxiety tends to complicate them, or even vice versa. In the past few months, I have received a number of queries in this context. How people have felt this shaking feeling before a practical examination, or when medical students are trying to perform some minor procedures, especially when someone who can judge them is observing, while doing chemistry experiments, while trying to do very fine work, which they were sure they are going to end up in tremors when they attempt it. So it means that tremors and anxiety are very closely related to each other. How does it feel when anxiety leads to these tremors or tremors get complicated by anxiety? There is this shaky, trembling feeling in the body, which can affect your hands, fingers, feet, legs, your head, your chest, back. There is a churning feeling in your stomach. And what do you end up doing? Fumbling while handling objects, knocking things over accidentally. For medical students, they'll probably remember any other procedure except the one that they are supposed to do. You even tend to have a shaky voice at the time. But do they ever end? Well, yes, they do, as soon as the stressor goes away, which could be about 20 minutes or so. But if these tremors are persisting even during your daily tasks, for example, while you are eating, trying to hold a glass of water, trying to write, draw, use a brush, use a spoon while eating, then it is more likely essential tremor. What happens in our body if you already have tremors and anxiety worsens it, or there is a generalized anxiety? Some hormones are released, like adrenaline. They make our muscles tense. Our nervous system acts faster, so we drop things, fumble with things. A state of hyperarousal is reached. And people simply call it a case of nerves. But this can get complicated by so many factors like lack of sleep, dehydration, affected magnesium levels in your body. If you have this impending thought of what might happen, always thinking of the worst case scenario. What if the questions in the exam are difficult? What if I go to a social situation, I already have tremors, and if everybody is watching and I drop things too much, what will everybody think about me? What if the procedure is too complicated and I will not remember the steps? All these impending thoughts complicate the matter. It is important to differentiate between psychogenic or anxiety-based tremors and neurological-based tremors. There will be an abrupt onset and a spontaneous remission. Both resting and movement-based tremors might happen at the same time, but their brain areas are different, basal ganglia and cerebellum, so they do not happen simultaneously in cases with neurological causes. Also, a difficulty in concentration, your mind going blank, not able to focus on an activity is more commonly seen, resulting in tremors. These tremors, whether because of anxiety or because of a neurological cause, can be managed or reduced with mindfulness exercises. The one best exercise is simple breathing. Try to do this in a place which is stress-free. You don't have to focus on any kind of distractions. A calm environment, maybe in a park, where you are simply sitting, trying to breathe through your nose and breathing out through your mouth. Taking twice as long to breathe out, at the same time closing your eyes, realizing the personal space around you, feeling that your body is heavy or light, whether your body is still or moving, and not at all focusing on any stressful thought. The second mindfulness exercise would be taking the thumb of one hand and pressing in the palm of the other while simultaneously breathing. Third, trying to improve your body's orientation in space, try to press your palms together for about 15 seconds. Fourth, try to place one hand on your belly and the other hand on your heart and try to breathe deeply. Fifth, when you are during a stressful situation or when the stressor is around, simply closing your eyes, giving a visual break, even for 15 seconds, helps a lot. Sixth, try to inhale for about 5 seconds and give a sigh because it helps to relax your body. Seventh is called monkey stretch. Simply stretch your arms sideways like you are tensing them and let go. The same way you can do forward and let go, or you can do it overhead and let go. The eighth one would be the simplest one available around you, trying to drink water one sip at a time and relax and sit while you try to do it. Wall pushes. Try to place your hands against a wall, push and relax and keep breathing with it. And finally, try to pull your shoulders down because you would have realized that whenever you are tense, your shoulders get hunched up. Relax them and try to focus on one point. Follow them on a regular basis and find the difference. If this video was informative for you, please leave a like, subscribe to the channel because I will have more videos in this context available. Ring the bell icon for notifications and we'll meet again soon.